My name is Sean Thomas, and I'm the author of Be More Today, a 40-day guide to a better version of you. As Doctor of Physical Therapy, I've seen thousands of people do great things. They came to me with ailments, physical ailments, pain, issues, and they got through them, all because they decided in their mind they were going to do it. And I guarantee you, if you just trust the process and be persistent, you too can be the best version of you. Have you ever been out and about with nowhere to stash your keys and ID so you can be hands-free? Whether you're running errands, traveling, or hitting the trail, Spy Belt is the belt that goes where you go. Made with stretchable fabric and a low-profile design, Spy Belt is your perfect companion to keep your essentials secure without bouncing or chafing. Choose from several prints and colors in the original, a wider band in the Pro versions, or the newest Spy Belt, Whiteout, an all-white belt that is perfect for summer. Visit www.spybelt.com to get your Spy Belt today. Run smart, run free, run with Spy Belt. Don't let aches and pains hold you back from living your life. At JAG Physical Therapy, our experienced clinicians create a personalized treatment plan that fit each and every patient's needs uniquely. Whether it's recovering from an injury or enhancing your performance, we've got you covered. With over 150 locations throughout New York, New Jersey, and Pennsylvania, there is sure to be a JAG Physical Therapy location near you. Visit jagpt.com and book an appointment today to get back the life you love. That's jagpt.com, jagpt.com.
Welcome to the Be More Today show. Don't forget to like and subscribe to our show today. Now, let's hear it from our host, Dr. Sean Thomas.
What's going on, folks? Your boy again, Dr. Sean Thomas, back in the building with the Be More Today show. We are back in the building, folks. And again, it is the month of October. Happy National Physical Therapy Month. It's the best month. I love this month because we celebrate all the PTs around the world. Before I talk about any of that, Be More Today is a movement, as you already know. We're in season 5 of our show right now, and our 10-year anniversary of Being More Today. It's been great talking about going out there and really hitting your goals, not just talking about those things, but actually doing those things. And it's been my pleasure escorting you through this journey, Be More Today journey from 10 years ago, from our more merch to our swag store, to our Steps to Greatness Challenge, which continues to go on right now. There are people, right now we have about 56 people doing a steps challenge, 10,000 steps for 40 days. They're doing it well. And it's been a pleasure, actually, just watching people take their health and wellness seriously. My book, which is coming out soon, folks, I'm in the editing processing of it right now. The process continues to go for Project More. It's going to be my second book. I'm looking forward to that. And I want to thank you all just for your support and love. It does not go unnoticed. Now the show is heard in 86 countries, over 65,000 downloads. Again, thanks to your love and support. This show continues to go forward. And I thank our sponsors, Spy Belt, and our sponsor, JAG Physical Therapy. And they are the guests on the show today. Our quote for today is very, very simple as always. The results you're looking for are hidden in the work you're avoiding. The results you're looking for are hidden in the work you are avoiding. One of the things I love about being a therapist, a physical therapist, is that by definition, and I found this somewhere, I didn't know where it was. Physical therapist, definition, a healthcare professional who can solve problems you thought were incurable in ways you never thought were possible. A muscle whisperer, a healer who transforms lives. See also miracle worker. And I think those are all things that hold true what we do as PTs. And one of the things that we love to do as PTs is to look for results and help people to get the results they're looking for so they can be better versions of themselves. And it's hard. You want to go out there, you want to get over your issue, your ailment, your disability, whatever your challenge is. And sometimes what you're looking for is really hidden in the work that you're not doing. And our job is just to simply showcase that, expose that, highlight that, to show you what you can be doing to get back to the life that you actually do love. And one of the people I have on this show for this month, as we celebrate PT month, I said, who can I bring on the show who's someone who's been embodying this thing for longer than me, someone who's been really a pillar of physical therapy, not just in the NYC area and not just for others, but for me personally. And I thought to myself, let me just look through my Rolodex, and I said Rolodex of people that I know that have really impacted me in a positive way. And I said, who better to have on the show than my friend and the vice president of clinical services at JAG Physical Therapy, Giovanni Materia. Now, folks, just so you know, Giovanni is not just the VP of Clinical Services at JAG. JAG, again, is one of the biggest healthcare providers for PT in the Northeast, over 152 offices in the tri state area and expanding more every single day. But he is actually the person who hired me at my current job. And most folks don't know this story. We'll talk about it a little bit as we get into the show today. But, folks, ladies and gentlemen, boys and girls, pets included, please welcome to the stage my guy and the VP of Clinical Services at JAG Physical Therapy, Giovanni Materia. Gio, what is going on?
Sean, thank you so much for that intro. It has been a very long time since I've met you, and I did indeed hire you, and probably that was probably one of our best moves that we've done so far. I mean, look at you now. I mean, obviously, and we'll touch upon it, I guess, throughout this talk. But it's one of the biggest things that I find rewarding to myself, um, is seeing everybody grow in their own way, whether it's professionally, clinically, whatever it is. Just watching everyone, especially you. I mean, the things you do, uh, it amazes me, and I've always told you, I don't know how you do the things you do. This is the perfect show. You Be More Today, the 40-day, the book you wrote. I mean, it's amazing what you've been doing, and obviously you inspire other people as well, and that's what we all kind of try to do.
I appreciate that, Gio. That means a lot. And yeah, you and I met. I did an affiliation with our company years ago, and my CI at the time, this guy named Anthony, and he gave me a name, Rich Bodian, and Rich Bodian, and clearly Rich is a pillar for JAG also, and one of the founders of the company from its inception, and I actually got fired. I don't know if I ever told you this. I actually got fired from my job. I've never told you this. I'm gonna tell you this right now on the
No,
show.
you did
So
not.
I worked at this company in the city, which I will not name on the show. I worked there for about a year and a half, and as you know, and I've told people on the show, I had a problem passing my license, my board exam. I took it 3 times and I passed it, or I failed every single time. And I had to go from being a student PT under a temporary license to doing work as a PTA. I was still doing PT work, but I was under a PTA license. I passed the PTA
Right.
exam, took their license, it was fine. And the person I was working for hired me as a PT, so he was looking for me to be a therapist, right? To bring in the evaluations, all that stuff. And without really saying that he couldn't really keep me on as a PTA, he kind of took me to lunch and then had a conversation with me about how to study for the exam a little better, gave me some tips. And the next thing you know, I get an email talking about cutting my hours, and I already saw where this was going, right? So I
Right.
reached out to Anthony, who again was my former CI, and he mentioned Rich Bodian's name, for a long time ago, and I kept the number in my phone just in case anything ever were to go awry. And I remember reaching out to Anthony that week, being like, "Hey, what's that guy's name again you were talking about?" So I called and made an interview appointment, and they said I was going to be meeting Giovanni. I said, "Okay, I don't know who Gio is. I thought I was talking to Rich, but that's fine. I'll talk to Gio, whatever it takes." And I remember coming to Georgetown, where I am now, and I've been working here for the last 12 years. And I remember meeting you and having the interview with you, and you hired me pretty much on the spot. And I got hired that Friday to start on Monday, and I got fired that Friday from the same job. So I got fired on a Friday, and I started working on a Monday, and I've been with JAG pretty much for the last 12 years ever since. So our meeting, our interview, our connection, and the fact that I'm still rocking out with you and you're rocking out with me for the last 12 years has been great. And it's been a seamless transition into my growth, as you've seen, from passing board exams to doing stuff now with the company, with inclusion and engagement and whatever else, and to Be More Today, whatever. It's really a testament to you really having faith in me. Um, because you didn't know my backstory, you didn't know, why I hadn't passed my board exam, but you brought me on. And I really want to just say publicly, I really appreciate that. I really appreciate the faith you had in me, and appreciate all the fun times you've had, from dance parties to whatever else in between. So
Yes.
I'm glad to have you on the show today. I really appreciate it.
Thank you. Thank you for having me, Sean. Much
No problem.
appreciated.
No problem. So listen, G, you've done so many things. I know you have a background as an athletic trainer, and your role in the company has been um, one of the pioneers really from our one-on-one days to our JAG one days to now JAG. What has been that journey for you? I mean, you've kind of done all the duties, right? From being an aide to being a PT to being a regional to being senior regional and now vice president of clinical services. You've kind of seen the gambit in terms of how PT has grown and how this company JAG has grown. So, how did you even get into this in the first place? And what has been your experience going through the various levels and positions that we have in the world of physical therapy?
So let's see. So you want the short version or the long version?
I want the long version. We got
All right,
time.
I'm gonna give you the long version. All right. So I actually, when I first got into, after high school, you go to college, you don't really know exactly what you really want to be, yet. Some people are lucky enough to kind of have that streamlined goal set and they go for it from start to finish. I really did not know. So, I kind of probably took a major, what maybe some people, instead of liberal arts, I took business administration. And Sean, if I tell you, my first semester was probably the worst semester I've ever had in college. And to be completely honest, I'm not ashamed of it. I did not do well because I was not interested in that subject, into that field. I remember going into a class and the professor had a very monotone voice, probably like myself, because I heard myself on video. But it kind of reminded me of like Ferris Bueller Day
Mm-hmm.
Off,
Mm-hmm.
when he's like in the economics class and everyone has that that dumb stare kind of thing. They're just clueless,
Yeah.
and he's asking, like anyone,
Yeah.
and
Yeah.
nobody's answered until like you open up the shade, like and then you see the light. So that opening up the shade for me was kind of thankfully it was actually through my father because he had a a barbershop local, like on Nostrand and Avenue P, I believe.
Mm-hmm.
So it was near Brooklyn College. So everybody from that community used to go there. And I got introduced to what my good friend of mine and my best man, Ian Nagel, through him, because obviously I told my father I wasn't interested. He was trying to help me out. So I met this Ian Nagel, and he became my mentor, my guiding light. Kind of helping me navigate through what I wanted to be. So at the time, he was an athletic trainer.
Mm-hmm.
So, and he kind of pulled me under his wings, and he introduced athletic training to me. He spoke about physical therapy, and he said, hey, "Listen, physical therapy is what he was doing, but he was, since Brooklyn College did not have a physical therapy major at the time, it was a grad school. He said, why don't you try athletic training? It's pretty much like physical therapy just for athletes.
Mm-hmm.
You know, very simplified. We do a lot more, but that's a simplified version." So I said, okay. So I did the athletic training room at Brooklyn College. Um, I started kind of just looking into physical therapy. I was like, oh, this is going to be a thing. Probably that's for me. I started working at Midwood High School, which was right next to it. I actually did their Hell Week for their football camp. So I started doing all these athletic training events, and I loved it. I loved being with people. I loved helping people. I loved seeing results. As far as you rehab them, and from start to finish. Because I used to see them on the field, and then he actually helped me get a position with yours truly, Rich Bodian, at a first place that he actually worked as a therapist, not as an owner. Um, in a local rehab clinic. So I worked there as an aide as well.
Mm-hmm.
So that's where I got my whole experience for physical therapy. I was working there as an aide for about 3 to 4 years. I majored in athletic training, and at the time they had it was almost like a clinical hours. It wasn't a direct accredited program, but it was at that time you're able to do 1,400 hours, sit for your boards, alongside taking some classes in college. So I did that route, and that's how I got introduced to physical therapy. And then, that was pretty much the start of my kind of profession, and I loved it. I mean, it's exactly what I wanted to be. I was around people. I love to talk to people, and probably the most important time of my life, and obviously he still is best friend, best man, and we still keep in touch. Unfortunately, he's in Florida, so I don't see
Mm,
him that often, but
mm.
we still do keep in touch.
That's awesome. That's
Yeah,
awesome. And I love the connection. I love the journey for you. I feel like it's really almost a seamless one, almost one that just kind of made its own way. And I keep hearing you say you love people, right? You love people. I like working with people. I think that's one of the pillars of, what we do. If you're not really into the people business, right? It's customer service, it's sharing, it's engaging, it's smiling, it's all those different things.
yeah,
Physical touch. And, if you're not into those things, it might not be the profession for you. But if you really are, I think it is one of the professions that you can really showcase all of those skills, talents, personalities,
yeah,
feelings into it. And I think the best therapists are the ones who really can embrace that. They're really great with people. Yes, knowing the knowledge base and all those things, but your ability to engage and connect with somebody is a big one. It's
yeah,
a big one. Yeah, yeah. So,
absolutely.
and now, I've been able to work with you, as a staff PT and as your associate at one point in time, and when I was taking over the director spot here that you had at Georgetown office, seeing you go to be a regional, senior regional, and now vice president of clinical services. For those who are listening, and even for those who may already know, what does your current job entail? What does the vice president of clinical services at JAG Physical Therapy do?
So yes, we do operations, clinical operations we manage, but in overall, it's a lot of multitasking. So I deal with, and when I say it's a whole team. We have a whole clinical team, but so we're dealing with budgeting, staffing, establishing clinical procedures, policies, and protocols. Um, and with other departments, we're always collaborating as far as the professional development. So we help them kind of develop new ways of growth, because we're always looking to obviously have our clinical team, our staff, ways that they want to grow, whether it's financially, professionally, or clinically. Because some people are just not made to manage. That's not what they're looking for, and that's perfect, because you can't have everybody managing, because then you're not going to go anywhere.
Right.
So we have developed different, let's just say, pathways for clinicians. One is we just kind of came up with is the advanced clinician pathway. So if there's any clinician that's not interested, let's just say in the managerial side, becoming an associate, a director, a regional, they could go into this clinician pathway where they could help directly students, clinicians, become a better version of themselves clinically, taking various certifications, and then and with that obviously comes some type of a of a monetary kind of advancement as well, but it's mostly clinically, which is what that person is looking for.
Yeah.
Um, but and part of that is pretty much the favorite part of my position is staff development, and that's what I think is my forte. Obviously I like now. I do should say, looking at numbers, it's kind of intriguing. It's almost like a puzzle, trying
Mhm.
to fit everything together to make that big picture. But it is staff development, and we also are, in 2025 we developed a residency program. So we're going to be starting a residency program, which we've never had. So me in this new role for me is trying to figure out ways I could give back to the clinicians. Yes, I still have to manage or help manage offices, budgets, and make sure, we still are a business. Uh, but, the priority for us is our care that we give our patients and making sure our clinicians, our staff, are where they want to be, are doing what they want to do. Um, and they're, compensated properly for their positions. So they're more productive of what they're going to be doing, more quality of care. Let's just say they kind of, they'll be more into it. It's not a monotonous kind of day. So, it's that type of thing that we look to do as far as every day. So it's multitasking, like I said, but overall, I mean, it's a nonstop. It's pretty much what you're doing on a daily basis, but on a grander scale.
Yeah. Yeah. I appreciate that. And, again, congrats on that role, and you've earned that. And it's been, again, it's been inspiring actually watching you, uh, receive your flowers the way that you should. A number of the clinicians who've been in our office have gone on to be leaders in the company as well. And I think it's all due to your tutelage, due to your experience, due to your yearning to see people around you also excel. And I think you've done a great job at doing that. So,
Thank
um,
you.
and I'm thinking about all those who are listening, either they're PTs in their own regard, or they're looking at their own professions, or their aides who are listening, or whoever else. And I think you've done everything right, from the AT world to the aide world to the being a staff therapist, and now in the corporate sector. Are there certain things that you can share that you took as keys, maybe to your rise in the company and your success? Anything that you want to share with those who are like, oh, I want to kind of do what he's doing, or I'd like to be in leadership, or I'd like to do something that's bigger than what I'm doing in my own current role as a staff member. What are maybe some keys you can share to either aspiring PTs, current PTs, or even people in different professions, in other jobs, in other professions, about how they can rise up, or how they can raise their standings, or even their potential in terms of being higher up in the ranks of their personal jobs.
That's a that's a great question. But so the key things that I think is, and by far the priority is, you got to put in the work. It's work ethic. So something that I've always done, and it's, I give it to what my father kind of inbred in us. It was work, put in the work, and you will see an outcome. You know, he's always to say, if you don't think anybody's watching, you're mistaken. Even when
Mm-hmm.
you don't think people are watching, they are watching, and they'll notice whether you're doing a good job or a bad job. Even if they're not praising you, even if they're not telling you you're doing a bad job, or improve, you need improvement in this area, they're always watching.
Yeah.
And that's by far 100%. So from when I graduated New York Medical College as a physical therapist in 2001, sweet Lord, that's a long time ago, uh, up until like 6 years ago, when I was treating almost like full time, I was also working as an athletic trainer.
Mm,
So after my 8 hours or 9 hours at work,
right.
I used to go to Lincoln High School, cover their practices
Mm-hmm.
until 7,
Mm-hmm.
get home about 8, 9 o'clock, do my notes,
Mm,
and repeat the day all over again.
right.
Uh, and then with the athletic training, I used to cover their games, which were on Saturdays or Sundays. So at times I worked 6 to 7 days work weeks. So I believe you got to put in the time. You got
Mm,
to put in the work, and everybody will notice the type of person you have, the work ethic, and that speaks volume. You might, I'm not perfect. Nobody's perfect, but you have to have a good foundation. And if you're willing to put the work in it, that tells you that, what, if you have something that needs work, you'll put in the extra work to fix it, to make it better. That's the first thing. Another thing is, I 100% believe in being completely honest and truthful to my colleagues whenever we're talking about anything, whether it's an upcoming possible promotion, or giving them advice on a clinical note they wrote, or a functional assessment, so anything that needs to, but be very honest with them. Obviously, say it properly. Be very constructive, and always. I try never to be negative, but be truthful. Because the way I treat everybody else, the way I would like to be treated. I want to know exactly what I was doing wrong, so I know what to work on. And and if I'm doing something right, yes, I would love to know it as well, because everyone needs positive reinforcement.
Yeah.
It can't always be, and everyone always, it's like almost the reviews that we always get. People are always very quick to give a negative review, right? Not so much a positive. And you always like remember the negative thing about something.
Yep.
So it's always, and I try to always when I walk into an office, is let the staff know what a great job they're doing, because everyone needs positive reinforcement.
Yeah.
And people are working hard. I mean, every single day, and they need that once in a while. They need that confirmation, that positive feedback.
Yeah.
And then one other thing is building relationships, um, long lasting relationships with your colleagues, coaches, doctors, patients. Like you said before, you never know when you might have to go into your Rolodex and reach out to one of your contacts. Those relationships might open up a door later on.
Yeah.
So
Yeah.
never burn bridges, and make quality, lasting relationships.
Yeah.
Um, and then one last thing is it's something that like I said, I enjoy doing, is giving that advice to my colleagues, to my, whether it's you, an aide, a front office, anybody that I see has a question, or you know um, for example, Stan, our good friend Stan, who we watched grow from a volunteer and aide to now a therapist, to a CD of an office, right? So doors open up all the time.
Yeah.
So things like that make me so happy, as far as it makes me value what I'm doing. I did something right. Uh, and he's, I used to give him, and I still, if he has any questions about financial advice, I also give him financial advice. Any type of advice that I could possibly give, I would. Anything that worked for me, that's what I tell them.
Yeah.
They could take it as an advice, not use it, but I'll give them what worked for me and what hasn't. Uh, and that's about it. Another thing that comes up is for example, on advice, is why not give? How many people want to give up, in their application process to getting into PT school?
Right.
Right? It's so hard, right? Competition.
Yeah.
Everyone says you need a 98, 99 GPA. So to get very personal, I don't think a lot of people know that. You might know that because you've been with me so long. But when I was in Brooklyn College, and I went to my guidance counselor, and I told him I wanted to do physical therapy. Given my first semester was not a good one, shall we say, my GPA was not up to par.
Yeah.
Right? So she's like, "Oh, you'll never get in. Don't do it." She was discouraging me in becoming a physical therapist. So I took that negative energy, and it propelled me forward. So I used that, and what I did was, okay, my GPA is not good. That's no problem.
Right.
I took 38 credits over. So I didn't graduate in the typical 4 years. It
Right.
took me 5.5 years, but I got A's in 38 credits.
Wow.
So she was my driving force to take. I not only did I take them over, but I took tutoring almost in every class. So I was in school pretty much 10 hours a day.
Yeah.
Um, and that's that was my propelling force, to drive forward, and because I was determined to get into physical therapy.
Yeah.
And I give that story to people that are having a difficulty. They have to write the essays, or the the application fees are high.
Mm-hmm.
Some people like, listen, it's worth it. Do what you have to do, and get it done, because afterwards you'll be you'll be in the right place, because that's what you want to do,
Yeah.
and you're going to make a change. So
Yeah. Yeah. Those are good gems, G. I hear a lot what you're saying. I hear a lot about investing in yourself. I think a lot of people get weary or get worried of whether it's a class they have to retake and the finances that go with that, or even when you do pass the classes for PT school and then you're taking the board exam and paying for maybe like the Final Frontier or something that they have now to do
yep,
the all new things now. They didn't have when we were in school, but all these classes that you take now, and you look at the price that's on that for the classes,
yes,
but not really looking at, well, once you get past that, there's such a bigger door and world you could be exposing yourself to after that. So just do the small work on one side,
yep,
and then you'll see at the end it will pay off.
yeah,
I also took from that what you said about the work, and I agree with you. I do think that there is a mentality, and I don't know if it's a new school mentality or just happening now or whatever it is, but the perception that I just want to be wherever Geo is. I just want to be wherever Sean is or whoever, wherever Stan is, right? Without thinking about the steps that Geo had to take to get there, right? Unless you had shared it right now, no one would have known you had gone back and taken all your classes over again. They would have known you were working 10-hour days. They would have known you were doing so many things on the back end just to do what you're doing now. But all they see is, well, he's the VP of this, and that's great. I want to do that. And I see it. I see it in our profession. I see it with a lot of newer grads that are in various companies. And to be honest, even my wife sees it in her profession with a lot of the newer lawyers she's working with. So I know it's across different professions and different didactics, not just us. And I'm curious if you know or have any thoughts on this. There's a lack of dedication to the craft. There's a lack of dedication to saying, let me put in my 10,000 hours. Let me learn whatever I have to learn. Let me ask all the questions. Let me go and do what I have to do so I can be the best at my profession first. And then when I've gotten all those results done, when I've gotten all of the input that I need, when I've gotten all the experience that I can gain, now I can talk about doing something bigger in terms of being the director or the leader or owning my own thing or whatever else. And yes, like you said, people are always going to be watching you. So when you're doing that work and people see you doing that work, then they'll say, you know what? This guy Stan's doing a lot of work. I'm really impressed by him. You know what? Maybe we should consider him for management or upper management or whatever else. And I think that's how it goes. But on the flip side, what people see that the newer generation or whatever we want to call it is well, I want that. So I deserve that. And just give it to me. What are your thoughts on maybe tips we could be sharing with new grads, aspiring PTs, or anyone else and who's in like the beginning stages of their professional careers and even different didactics or different professions about considering leadership, but not really putting in the work on the ground level and to make sure that you're honing in on your craft first.
okay. So where do we start? So the first thing I would say to and I think I actually say it to everyone already, to all the, just say, RCDs, to the senior regionals, and they're all doing it, and that's why they're in that position. Is lead by example, right? Uh, don't don't lead. Don't be a leader, and don't manage your staff by force, by like an iron fist. Uh, lead by example. I still, when I go into a clinic, I'm still walking into a clinic. If there's garbage on the floor, I'm going to pick it up. I still go and fold towels. Uh, I was covering a clinic in Brooklyn on Friday. I'm wiping tables. I'm not going to not wipe tables because I'm the VP of clinical.
Mm,
No, I'm a therapist. I'm a person. The person who's helping me is a person.
mm-hmm.
No, don't treat him that just because he's an aide that he has to, he's below you.
Yeah.
No,
Yeah.
treat people like people. And John, Galucci, our CEO, and he couldn't say it better. And I always say it is we are people treating people, and that goes so far because you know patients, your supervisor,
Mm-hmm.
are all watching, like you said,
Mm-hmm.
right? You working every single day, 5 days a week, you're building your resume for your next step. Whether you're typing it out or living it, you're working on your resume so
Yeah.
that your leader is going to know what type of person you are without even talking to you. He
Right.
sees your interactions, he's seeing what you're doing, he's seeing the effect that you are giving to your staff.
Yeah.
That's what makes a good leader. You know, another thing as far as leadership is, sometimes you got to take a step back. You know, don't always hold the reins so tight on everybody. You
Mm-hmm.
know, let them go. Let the person below you a little bit fail. There's a lot to learn from when you make a mistake.
Mm-hmm.
So let them fail. Don't always, kind of hold them by their hands, because that drives sometimes a little bit more than just kind of like taking you step by step up the chain.
Yeah.
Um, Another thing is seek feedback, right? We're always saying, one of the questions always, how are you taking constructive criticism?
Right.
Uh, Everyone's always saying, "Oh, I'm great. I great." Yeah. No, some people are not great. So a good way to actually take us is asking for feedback. You
Mm-hmm.
know, seek feedback on what you're doing and seeing, what you could improve on, and then learn from your experiences. Where, like we said, like if they're good or bad, there's always something to learn from every experience you have.
Yeah.
Um, and then in any role you're in, take time to kind of improve in that role. Improve your skills, whether you're taking um, you know education courses, continuing ed education as a therapist, or if you're a leader, yes, we still have to take education courses, but maybe you read leadership books,
Mm-hmm.
different style leadership, and you take little tidbits. We always say, let's see, you learn how to use Graston as a
Yeah.
as a soft tissue technique. All right, you'll put that tool in your toolbox.
Yeah.
You don't have to use everything every single day.
Yeah.
You'll notice that maybe one tool is better at reaching a person than another tool.
Mm-hmm. Mm-hmm.
So everybody has a different style of leadership. Every person that you're leading might need a little different type of communication, not always the same. You can't treat everybody the same. Everybody has different personalities,
Mm-hmm.
and you have to know how to talk to that person, how to get through that person.
Yeah.
um and then going back is building relationships, right? Networking is crucial, right? If you want to grow in a company in a leadership role, you have to know how to network. That's part of being, in that position. You network, you cultivate genuine connections with people, and then those people, if you need them at any time, you can reach
Right.
out.
Yeah.
Um, you know, um, and then another thing is that some people think it's below them is any type. If there's any leadership or any type of opportunity to lead or volunteer in something, whether it's immensely small, take it. You
Mm.
know, some people think it's going to be a waste of time. Oh yeah, I don't want to do it. Or
Right.
even like we have these tidbit Tuesdays. Be involved in those. And as you do more, you're going to be noticed. You're it's almost you're adding to your resume. you
Yep.
know and then I think one of the last thing is being a team player. Being a team player which is huge. you know and show everybody that you're able to work with everybody,
Mm-hmm.
not with just one person or one type of personality. Everyone.
Mm-hmm.
And that reminds me of one instance when I actually my interview at NYMC at New York Medical College. So you typically interviews are one-on-one, correct?
Yeah.
So I went in thinking it's going to be a one-on-one interview. So
Mm-hmm.
I walk in, it's like, all right, you're going to be, go into the room. And I go into a room and there's six other people.
Mm.
And now six other people, there's a timer
Mm.
on the table with everyone now has as a sheet of paper
Mm.
with pretty much directions. And it says, I remember, I can't remember specific, but I think it was your plane crashed, your supplies all over the place, you know, what are you going to be doing?
Mm.
So what they're doing there is they're going to see who takes lead,
Yeah.
who's going to be the leader, but they're also seeing who's able to work as a team,
Mm-hmm.
right?
Mm-hmm.
Not just because everybody's important in a team, not
Right.
just the leader.
Right.
Uh, just like in rowing, right? What's the steerman's name? Coxon,
Yeah.
I
Mm-hmm.
believe, right?
Mm-hmm.
So he leads the boat, but then you have all the rowers that
Yep.
have to work at the same time,
Yep.
right? So if you don't have, he dictates the tempo, and you actually executing the tempo.
Right.
So everyone's working for the same goal, for the same thing, right?
Yeah.
And if everybody works together, then you'll win,
Yeah. Yeah.
and that's the biggest, I think, thing. It's and it goes a long way. It goes in every possible field that you could think of, and
Mm-hmm.
it's teamwork.
Yeah. Yeah. I agree with you. The illustration you just said is poignant. It does take a team to do that. And um I think a number of people fall into that category, right? You had your people who just want to work, and that's fine. Clock in, clock out, no problem. But just do your job. Whatever your job is, just do that job well. And like you said, doesn't matter who it is. If you're walking in, you pick up something, you do whatever else. There are we have all the roles. We have all the roles. Like your role is to do everything here, and I think that's when you really see the best PTs, right? Because they're selfless in that regard. And I remember I was watching uh, probably Rich Brody and probably you just interact with patients. And it, I remember watching Rich when he was treating full time. Anyone that he interacted with was his patient. It didn't matter who it was. It didn't matter they were on his schedule. It didn't matter who. Whenever he walked into the building, whether he saw that person for the first time or had seen him 1,000 times, in that moment, that was his patient, and
Right,
he would give them whatever they needed, set them up on the bike, talk to them about their exercises, talk to them about their history. It didn't matter what was going on because at that moment he was therapist, they were patient, and that's all that mattered.
right,
And I think if more people embody that same sentiment, just to say, you know what, my job is, like I said in the beginning, yes, my job is healer. It's work on people. It's the connection. To do that with everyone, not just, oh, what, that's not my patient. I hear that all the
right.
time now. That's not my patient. What are you talking about? No, 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 no. If there's a patient that's in the building, that's your
That's your
patient. Whether it's not your patient you've seen like 1,000 times or one time, your job as a clinician is to help people.
right,
And I think that we're losing that sometimes in this newer age where everyone just wants to do their silos, stay in their little silos and just do their own thing. No, it takes, like you said, it takes that community work. It takes that work doing stuff as a team. And that's where you really see the successful companies and businesses and even offices where everyone knows that their small role, whether they're a leader, like you're saying, and you don't have to be a leader, right? Or just a staff PT, whatever the case is, they're doing their job. And then for the leaders, like you said, the ones who are actually going out there and doing the extra work, it does come down to, like you said, doing all the unmentionables and taking leadership responsibilities. And like you said, even taking the small things and using those as ammunition to be greater in other things. So I agree with you wholeheartedly on all those, Gio. Those are great tips. Those are great tips. Those are
yeah.
great
I
tips.
mean, yeah, it reminds me, Sean, not to interrupt, but
Do it.
like even like the little silly things that we do to the patients when they're coming off a table, like putting on their shoes,
Yeah.
help them put their shoes on.
Yeah.
We have some people sometimes are just looking at them and not helping them. I mean, the person's like, it's an elderly patient. They have
Right.
trouble putting, even though they say no, no, you put that shoe on for her.
Yeah.
Every little thing helps, make that connection with that patient, which, entails, it goes a long way.
Yeah, absolutely. And I think that's one of the things that, has really attracted and kept me at JAG and been here for now almost 13 years. Just really looking at the growth that we've had, the milestone, just passing 150 plus offices in the tri-state area. We've done such a great job of this same thing, just really putting customer service out there, making every office feel like it's family, right? No matter where you go, whatever office you're going to has a different feel based on the environment, based on the culture of people in those areas. And everyone who goes to our offices always says the same thing. It does feel like family. It does feel like we're coming together and interacting with therapists, yes, but the camaraderie, the friendliness, the smiles, the music, whatever the case may be, all those small things, even putting the shoes on for people, those small things make us different. And I'm curious, you've been with the company longer than I have been, and you've seen our growth. What have been some of the keys you think to our growth over the last couple of years for us to now be the leader when it comes to physical therapy in the tri-state area?
Well, first, just because we already said it, so I'm going to beat it to death, is we treat all our patients like family, right? That has been our motto since the beginning. Treat every patient like you would treat your mother or grandmother, right? We are people treating people, like John always says. Uh, not a therapist treating a body part, right? Or a particular diagnosis. People treating people. People have feelings. They come in pain, and you need to connect with that patient, all right, in order to make a significant change in their current mindset. Because when they have that severe pain, it kind of blocks their ability to see their next positive step. They only see the that pain right there. They don't see the light at the end of the tunnel. So you making that connection, you explaining all the steps, what they're going to be feeling in 2 weeks or in a month, what they have to look forward to. And then all right, well, you're gonna be sore, or you'll have pain for the first 2 weeks because you just had a total knee replacement, and usually about 2 weeks is where the severe pain kind of starts to come down. And then you're going to be able to do a little bit more. And you know what, after that 2 week mark, and they see that their pain is slowly going down, it's like, oh my God, they were so right.
Yeah.
You make that connection. They believe in you. You're opening up another door for them to go through and further go into their rehab process.
Yep.
So that's firm up the first thing. And then our relationships, our outreach within our community. We give back to our community each and every day, right? You're involved with it constantly, right? So we have provided anything, various education services to our communities, from career fairs, assisted living to assisted living, like full risk assessments, to just talking about our profession to high school, colleges, as well as medical school programs. And I think you were involved in this as well. We've had medical school programs, and we've talked to their residents on what PT is, and what their benefits are of physical therapy, and how we could work in conjunction as a team to provide our patients with the best quality care, so they can get back to their life they love.
Yeah.
So that's a huge thing, and as therapists, education, and for me, it is also a top priority, right? If you know what you're getting yourself into, or what you're gonna be, experiencing, you're gonna progress a lot better.
Yeah.
And then since the beginning, we've been leading pretty much we've been leading the field in quality of like care. We've been the leading provider of comprehensive care to our patients in our communities. And this is we've run a pretty much an in-network model because of that. So we can provide care to all our patients in all our communities, just not limited to the out of networks.
Yeah.
So we tend to that, and that's why we stayed as an in-network model, so we could provide therapy to everyone. And then we've been a staple in the tri-state area for over 20 years, right? So throughout those years, we have all contributed. Every team, every staff member, from front office to the back end of billing,
Right.
not
Yeah.
just a therapist. We are all contributing and building a solid foundation and reputation, right?
Right.
And this reputation and is it in combination with the excellent rehab services that we provide by our therapists,
Mm-hmm.
you know, has fostered this great reputation uh, by our patients.
Yeah.
Word of mouth. Uh, Word of mouth is the best marketing, right? And the best thing is that you don't have to pay for it, right?
Right. Yeah.
It's all done by our patients, and we love treating our patients, and they love to speak about us and how great they're doing, and recommend us to their friends, to their family. It's like an exponential type of a referral system without actually, doing anything. You just do a
Yeah.
great job, and you get noticed.
Yeah.
Just like building your resume.
Yeah, no, absolutely. You're spot on, and I think that's one of the great things about our company. Again, we've done so many great things, and shout out to our CEO John Galucci, who I share the same birthday with. I always say that on the show whenever I do a JAG show, and he's great. I mean, he is a man of the people, someone who really looks towards again everyone just doing their own work to be how they can be in their own regard better and
Yes.
looking at their betterment being the betterment for the company as well. And also shout out to our COO, Diana O'Friel, and of course, RB, our Chief Clinical Officer, and Kayla George, our Chief Marketing Officer. I mean, they all come together and just do great things for us every single day. And we're grateful. We're grateful for all the hard work that this team has done and you continue to do, Gio. I mean, when I think about all of the directors who've come out of our region, under your tutelage, right? From the Stans to Anissa's to Craig's to David's to me and everyone else, it really is a sentiment of you giving all that you could to exactly what you talked about in the show, right? To let the team grow, to share the experiences, to um, be a leader, and to model that behavior. All things that I think that leaders should do. And again, I just want to really just salute you and give you your flowers to let you know that you have the stuff, Giovanni, not just on the dance floor when Run DMC plays. You have the stuff in general. And when it comes to physical
Please do.
therapy, yes, for those who are listening, he's got some really good dance moves on the dance floor.
Oh boy, thank
We
you, Sean.
recently had
Thank
a JAG Fest recently, which was a big combination of all the offices in our area who came together and just celebrated our milestone of hitting 150 offices in the tri-state area, and it was just beautiful to really see our aides, our PARs, which are our front office or our patient access representatives coming together, and our clinicians and our ATs and our regionals and marketing and everyone else just coming together to celebrate what we love to do as therapists, which is to help people. And I think it's one of the best moments we've had in a long time, just really celebrating coming out of
you.
COVID, all that we've been through to get to this point and to go even further as one of the best PT businesses in the tri-state area. So Gio, I really just have two more questions for you. The first is more about you as a person. So I know you talked about being more active and I've seen your active journey over the years, wax and wane. But last
It's
time,
not consistent, Sean. It's not consistent. I got to work on that.
that's okay. But last time I spoke to you, you said you were getting back on your bike, you were doing some more stuff on the bike. So I'm just curious, how have you been or how do you plan to be more? We have about 3 more months now in this year. How do you plan to be more in the last quarter of 2024?
Well, besides, like you said, returning to a regular regimen of physical activity, which I'm pretty much choosing to be my bike. Uh, yes, that I haven't been consistent, to be completely honest, but I am aiming to be more consistent. I have to find that healthy work-life balance.
Yeah.
Maintaining a healthy work-life balance, um, and that to be more today for me in 2024 is a combination of finding that work-life balance, to furthering to excel in my current role, and to improve my leadership skills, and obviously continue to strengthen my relationships with all clinicians, staff, uh, in our offices. Uh, so the reason why I say that is I want to better myself so I could give back more or more effectively to our clinicians, to our staff, to our support staff. I want to keep striving to be an effective leader. You mentioned John. John is uh, like you said, the pillar. Reading his book and it's amazing what he has accomplished and his drive to move forward and his leadership skills you know and I know I can never be a John, but I want to be the best version of myself. So I am constantly reading books on leadership and trying to strengthen my own to to excel in my own role so I could better my staff. And I truly enjoy speaking with clinicians, young clinicians, and giving them advice, and then seeing them grow. The best thing that could ever happen to me, and it continues to happen. It's like a double-edged sword. I see the aides come out, go into school. After PT school, they want to come back and work for us. What does that tell you? We're fostering a great culture in our office.
Mhm.
And and they want to return. So if nobody puts time in to these clinicians that want to help, that need the help,
Yeah.
you're not going to get a return on it.
Yeah.
And when they come back and they become therapists and you see them grow up, yes, I realize that I get older and older every time one comes out. Unfortunately, I used to have hair. No comment, Sean. But
I got a picture somewhere.
I know, don't pull it out, please. But it, it it is amazing, and I couldn't even, that's what makes my day. It's like, same thing like when you have a patient come in a wheelchair and then they walk out or run out,
Yeah.
same type of feeling.
Yeah.
Right? Nothing could be better. That made your day, or when you're coming from you're having a bad day, you go home to your children, you feel everything. That's a type of feeling that I get every time I see these young clinicians come out of PT school that were with us as aides. It's wonderful. I love giving advice, and it doesn't have to be about therapy.
Yeah.
Anything that helped me in my journey, and it's a little bit longer of a journey that I kind of summarized here, but it's tough, but if I could get through it, if you could get through it, if John could get through it, anybody can, right? So that's, we try to do that to our fellow colleagues.
Absolutely. Giovanni, I gotta thank you so much for being on the show. You've made this episode geared towards PT month, one for the books. And if people want to either join our team as clinicians or even sign up to be patients at one of our JAG locations, what should they do? How can they contact us? How can they reach us?
The best place is our website, www.jagpt.com, www.jagpt.com.
Awesome.
Best of luck. Thank you.
No
Sean,
problem. Yes, sir.
I want to say thank you so much for having me. And like, I mean, I've always said it. I think you are amazing. I think you make our company a much better company. And you're doing a great job. Like you said, I wanted to give a shout out to everyone that's influenced me as well. And you have influenced me as well. Everybody that I mentored has also given back to me. So, I've always learned from them as well. I want to thank John, obviously, John Gallucci, Rich, Diane, just helping me kind of grow in my position, giving me the opportunities. And, the doors are there for everyone. You just have to know how to get to it and be patient, resilient, keep at it.
Yes, sir. Yes, sir. Well, thanks for the kind words, G. We appreciate it. And again, thank you for being on the show. You made it one for the books. And I look forward to seeing you hopefully before our next party. But I hope you look forward to seeing you soon.
Thank you, Sean.
No problem. And folks, you said so many poignant things. I mean, this is a great way to celebrate October. National Physical Therapy Month, and who better to have than my guy Giovanni Materia on the show? He's a gem, folks. He's done so much for me and so much for so many others that you've seen who've come behind him, and whether they're aides or PTs or in the corporate world, or even have gone on to other professions or other offices, and they're still doing their things. He's touched so many in terms of what we do as therapists. Again, the definition: healthcare professional who solves problems, that thoughtful, the incurable ways, and if that were possible, a muscle whisperer, a healer who transforms lives, a miracle worker. That's what we all are every single day. And I want to give him his flowers. And to all the PTs who are out there doing their thing, I salute you. I give you your flowers also. And our quote for today: the results you're looking for are hidden in the work you're avoiding. Let's just be better. Let's use this time, this month, to really focus on, yes, the other thing that we're doing, our highlights, our great things, but also look how we can be better as clinicians, to be give more results, not just for our patients, but for ourselves professionally, in terms of our mental health, in terms of our physical health, putting those things into practice so we can be better for our patients. And the things that you want to do, put some more work into it. If you want to be in leadership, do the work that you have to do so that you can be recognized and get there. If you're a staff PT, hone in on your craft and get those 10,000 hours in, so you can be the best PT you can at what you're doing. And if you don't know something, or you're kind of like, oh, I don't have to know that, learn it. Pick up a book, talk to a fellow therapist. Don't forget to go out there and pick up the things you see on the floor that are not part of your job, although they are part of your job, they still are. And remember that what he said, every patient is really your patient. We're people helping people. And the best thing we can really do for this month is to hide those things and be better for our patients and for each other. So, folks, happy National PT Month. I salute you. And until next time, have a good day. Have a good night. Have a great life, and continue to take your steps to greatness to be the best version of you. We'll see you next time. Peace.